Hello, welcome to our Facebook edition here at Interim HealthCare. My name is Amber Hasselberger and I am a care consultant with Interim. I am here today with Morgan Crenell, who is the manager of our PCSS services, personal care support services, which was formerly known as Home Styles. I'm sure many of you identify with that name, but we recently rebranded that service line, and we're here with Morgan today to kind of talk a little bit about PCSS and some of the changes associated with it, and especially during this time, during COVID-19. But Morgan's here to kind of tell us a little bit about herself and that program. So welcome, Morgan.
Thanks for having me. I'm excited.
I've personally worked with this program quite a bit in the past, and it's wonderful, and they do a wonderful job. So we're glad to have you here today.
Thank you.
So Morgan, how long have you been with Interim HealthCare?
So I've been with Interim 5 years now, since August, 5 years ago. So it's been great experience. Yeah, I started on the hospice team and then transitioned into this role about 3.5 years ago.
Okay. So with that being said, can you tell us a little bit about maybe your previous background prior to Interim, kind of what led you to Interim Health, and then what kind of drives your passion for that private duty type service?
So I think I always like to say that I was born into it. My mom was a public health nurse for many years, and so I really had the opportunity to see this firsthand from growing up, going with mom to work, understanding what it's really like to be part of home care. And from then, as soon as I had the opportunity in high school, I went through the EMT course for training as well as becoming a nursing assistant. And from that point on, I've been in home care. So everything from running group homes to working on the operations side with billing, payroll, private duty, I've done the whole spectrum and I've enjoyed doing it since day one. I would say, to answer your question about the passion, it really comes from seeing people thrive in their homes. You just have this great opportunity to see the difference in care that's received and people feeling comfortable, sleeping better, being able to see their friends and family, things that are really unique to being able to be at home and not necessarily in a facility type setting.
So you were born into it.
I was.
So speaking of that, what changes, I guess, have you guys at PCSS kind of had to adapt to, I guess, or make due to COVID-19, and where do you guys kind of see services headed now?
A lot of the calls that we're receiving right now is because people are considering bringing their loved ones into the home setting and making some changes in their own personal life to help meet the needs of their family or the person that they're helping find services for. The changes that we've made really have been around PPE, or personal protective equipment. So making sure that we're following the CDC guidelines as well as the Minnesota Department of Health to make sure that the clients are supported and well taken care of, and that we still can be in their homes to do those things.
So speaking of clients, what type of clients do you guys typically, what type of clients do you guys take care of?
I think that's what makes my role really unique, and our caregivers' ability to work with a variety of different clients on a day-to-day basis. So we work with people that have basic needs. Maybe they just need some companionship, light housekeeping, some bathing support or assistance, all the way up to individuals that really need that full care. Assistance with transfers, they're in a wheelchair, need help with all activities of daily living. And again, it can be as basic as just a conversation, but also providing that extended hour care and support needed in the home.
Sure. I know a lot of families are appreciative right now, especially of services like you guys have. So.
They are, and I think part of it is because people still continue and need to work.
Yeah.
And so to be able to have a trusted caregiver in the home to be able to do that is critical, so that people can still continue with their lives as well as know that mom or dad are supported at home.
Morgan, can you talk to us a little bit about kind of who your team encompasses at PCSS?
Absolutely. So we have a great group of a diverse staff. All come to us with experience in caregiving, whether that be in-home care or a facility like an assisted living or a skilled nursing facility. And they're coming to us ready to go, ready to care for these people, and we give them the tools to be successful. So that PPE, customized care plans for each client that we work with, and have a nurse overseeing those caregivers as well as the client, so we can best support their needs in the home.
What do you, I guess, say to possibly a client who might be on the fence of accepting in-home services, or not quite sure yet if they really need, a service like that, or if their family feels that they might broach kind of the subject with them? What is your advice, I guess, on those?
My advice would be to, let's start having the conversation. We have a nurse that's available to come out and do a complimentary consult and really work with the family to see if this is appropriate. Is this an appropriate time to start private pay services? Could our team support this individual in the way that they need to be supported? And how we can have a plan in place, so if they're ready to pull the trigger and that change happens, that we're there and we can make that change quickly and appropriately. I think a lot of times when we receive phone calls, it's when people, it's an urgent situation and they need help right away. But to be able to get in and start having those conversations early on is critical for the success of the client being at home, as well as us being able to help facilitate and guide that care.
And I can say again, I speak from firsthand experience just being in the field with you guys, and I can't say that enough. Getting you guys involved and just seeing your faces and having that early conversation is just really huge. So, and this is a common question I know that you guys get a lot. When people think private pay services, they think, oh my gosh, it's so expensive. I can't possibly afford something like that. What do you say to those people, and what are there payment options? What are some other forms of payment?
Absolutely. I always ask people to look at what they're gaining by getting the private pay services. If you are an individual that is still working and you're looking for services for just say your mom or dad, you're having to take off work, you're having to run to appointments with them, all those things that cost money, you just don't see it necessarily right away. So looking at what you'd be gaining out of the service. Is your parent able to stay in their home longer and not have to move? Would it give them the opportunity to thrive and have different services at home where they want to be and want to stay? So really asking those types of questions up front and identifying if it's an appropriate cost for your family is a good thing. As far as payment, at Interim we do accept credit card payments, so that's a service that we have added, and so that's been great so far, and it's allowed people to use that payment method as these things come up. Also, I would strongly ask everybody to start having a conversation early about the long-term care insurance piece. We have found that that's a benefit that's hugely underutilized or even known about, especially in the aging population. They might not have shared with their child that they had that policy or paid for it. And so then we're able to help walk through what that would look like, because a lot of times those policies will help offset the costs of private pay.
Yeah, and you make a really good point. People take out car insurance and life insurance and all of these insurances, and this is almost similar. I mean, you're paying for something that's so needed. So thank you very much, Morgan. We really appreciate it. And if people are interested in PCSS, they can give our office a call. That number is 651-917-3634. And I know Morgan and her team are more than happy to walk through any questions you have on how it would potentially be of help to you or your family. And so thank you, Morgan.
Thanks for having me. We appreciate it.
Yeah.
Thank you.
Thank you. So again, we thank Morgan for coming out and talking to us about PCSS. And again, I say this because people are still, I think, trying to get used to the new name, but it was formerly Home Styles. And so I know we do get calls still asking about the difference. But feel free to give our team a call, talk to Morgan. She'd be more than happy to kind of walk you through that. But to end here, again, we always go over our 3 service lines here at Interim. We still have our home care side, which is our therapies, our PT, OT, speech, and wound care and what have you, and more than happy to take those calls as well if you or your loved one are interested in some of our therapies here at Interim, and also our hospice side. And so our hospice department will do intake as well 24/7, just as I know PCSS does their intake 24/7, so does home care. So if you guys have questions on either of our service lines, we will take that call and help walk you through that. So thank you for joining us, and have a wonderful day.